Good evening, parents, friends, students, and Prince George's County Public School staff. My name is Richard Moody, as Dr. Faison said, and I am the supervisor for student engagement and school support. Also, as Dr. Faison said, typically when somebody asks me to do a presentation, it's generally about something or some things that we really want our students to do and that we're encouraging them to do. As Dr. Faison said, tonight's presentation is definitely not on something that we want our students to do or that we're encouraging. It is something that we truly want our students to avoid and make wise decisions about. So before I actually jump into the presentation, I wanted to share three points with you. And one is that in addition to tonight's parent forum, we have already started visiting schools, working with students, and doing grade level assemblies. The second thing is that I just don't want people to think this is a Prince George's County phenomenon. It is not. And some of the panelists that speak a little bit later on will reiterate this. This is a national phenomenon. This is countrywide. So again, it's not just Prince George's County, but it is here in Prince George's County, but it is also all over the country. The next thing I wanted to say before I actually jump to the presentation is that I personally do not believe that all of our teens are buying and overdosing on fentanyl. I don't believe all of our teens out there are buying Percocets and overdosing on fentanyl. They are not. But they may know somebody that is. They may know somebody that's thinking about it, a friend, a peer, an older brother or sister. So what we're strongly encouraging is take the message back that we're sending, that we're giving you tonight, both parents and students. Take this message and make sure that you share it with other people. Share it with other parents, share it with your peers, share it with your siblings. It's really important that the information gets out there. And finally, at the very end of the presentation, I will have the panelists introduce themselves. They've been very supportive in the work for the last few weeks that we've been doing. And you'll have a chance to ask questions, and we can use their expertise to help answer those questions. Can everyone see my screen okay?
Yes.
Thank you. As Dr. Faison said, simultaneous interpretation is available in Spanish. So here is what we know. Recently in Prince George's County Public Schools, we have seen an increase in the number of students that have overdosed on an extremely dangerous drug known as fentanyl. We suspect that several deaths can also be attributed to the ingestion of this drug. These students thought that they were buying Percocet, but actually purchased and ingested illicitly manufactured fentanyl. Several students' lives were saved because of the use of Narcan or naloxone. And in a couple of slides, we will talk a little bit about the overdose prevention drug, Narcan or naloxone. We also know that last year, 100,000 people died from drug overdoses driven by fentanyl. One shocking statistic, and it's here in the bullet, is that the fastest group of people that are dying from drug overdoses are under the age of 19. That is exactly who we have in our schools. That's our population. So that statistic is actually pretty alarming. Fentanyl in liquid form can be placed into nasal sprays, eye drops, dropped on paper, or placed in small candies. We all know that we've had several reported incidents of students that have had edibles in school. So this just makes me think, how easy would it be for fentanyl to be placed in an edible? Fentanyl-laced drugs are extremely dangerous, and many students are unaware that what they are ingesting is laced with fentanyl. Fentanyl is 50 times stronger than heroin and 100 times stronger than morphine. And I'm going to linger on this bullet just for a second. Heroin, as we all know, is completely illegal, and there is no redeeming medical value in heroin. Fentanyl, on the other hand, does have medical usage. It can be prescribed by a doctor, especially for really serious pain. Some people that have late-stage cancer may be prescribed fentanyl. However, the fentanyl that our kids are getting on the street is not medical-grade fentanyl. It's not prescribed by a doctor. It's not prescribed by a pharmacy. It is manufactured in factories. It's completely illicit. Just random people manufacturing it. There is no regulation of it, hence the danger. Fentanyl can also go by several nicknames on the street, and later on, some other people might chime in with some additional street names. But we've heard that it goes by Apache, Jackpot, Murder 8, and that last slang name right there should be a dead giveaway of how serious and how dangerous this drug can be. I had two articles, and I'm not going to read through the articles, but I wanted to share the articles with you. Again, just to illustrate that this is not just a Prince George's County phenomenon, that it is national. And this family that's highlighted in this article is from California, and the other article that's highlighted here, the students are from North Carolina. So I will read the first paragraph for you, and then I can talk to you a little bit more about the content of the article. The article begins when his father opened the door to Zach Didier's bedroom. The boy seemed asleep at his desk, still wearing plaid pajama bottoms and a yellow t-shirt. His head rested in the crook of his left arm, near his soccer trophies and the computer where he played Minecraft with friends. EMS was not able to resuscitate Zach. His father eventually tried to take the instruments away from EMS and resuscitate himself. He was not able to do that. Little by little, they started to hear things from his friends that he was purchasing Percocets. So they immediately told the police that, and the police immediately came to their house. The police asked for Zach's phone, and the police officer was able in 90 seconds to identify the person that Zach had been getting the Percocets from. Also, within that 90 seconds, the dealer actually reached out to contact Zach. So at that point, of course, the police officer said, this is a live one, and we're going to need to confiscate Zach's phone. So again, this is serious. It's across the country, and I just wanted to be able to share that with you. One family story. This is a picture of what real oxycodone looks like and what fake oxycodone looks like. And it really took me a long time, several days ago, to be able to really see that there's a difference. They look very much alike. And again, we could talk about some of the differences at the very end. But if it was difficult for me to tell which was real and fake, you know it's going to be difficult for a student to be able to tell which is real and which is fake. But again, the one on the left is a real oxycodone pill, and the one on the right is a fake oxycodone pill. So we did mention Narcan. And if you're not familiar with the term, Narcan is a nasal spray, or it can be an injection that quickly reverses an overdose by blocking the effects of an opioid. It can restore normal breathing within 2 to 3 minutes if administered quickly. And again, I've highlighted and underlined the word quickly because it must be administered quickly. Typically, I'll share this slide with students if I'm doing an assembly, and make the point that probably most students do not have Narcan in their homes. I know I don't. Most people probably do not. So again, it can work if you have it, but if you don't have it, you won't be able to administer Narcan. And most of us probably do not have it. All right, at this time, I'm gonna share a video with you that has a lot of really additional good information. It's called Dead on Arrival, and it's about 6 minutes long, and I'm gonna let that play for you right now.
What is inside this vial could kill you almost instantly. In fact, this much would kill you and I if we split it. It's odorless, tasteless, and it's currently being disguised as nearly any drug you can buy off the street. This is fentanyl. Fentanyl is a synthetic opioid that is 100 times stronger than morphine and about 50 times the strength of heroin. Fentanyl has sedative effects and will rapidly slow down a person's breathing. Just a milligram too much of fentanyl can result in hypoxia, a decrease of oxygen to the brain, and can quickly lead to death. Sounds more like a poison than a drug. If you were to ingest fentanyl and live, your body would begin having withdrawals within a few hours. Fentanyl is one of the most addictive substances known to man. It is also rather cheap to produce considering its potency, which is why it is being used in all types of illicit drugs. Pills, cocaine, methamphetamine, MDMA, even some instances of marijuana. Illegal drugs have been forever changed because of fentanyl. The most notable are the fake prescription pills. In 2021, the DEA alone seized over 20 million fake prescription pills made of fentanyl. These pills, designed to look exactly like prescription drugs such as oxycodone, Percocet, Xanax, Adderall, and more, contain nothing but fentanyl and a colored binder and are pressed to look just like the pills you would get from a pharmacy. The difference, though, is a matter of life or death. The DEA has reported over 42% of pills tested for fentanyl contain a potentially lethal dose. So maybe it's not the first pill someone takes, but one shortly after. Over the past few years, there has been enough fentanyl seized to kill every person in the United States. Fentanyl is being found everywhere in almost every drug, but you won't know it's there until it's too late. Your decision to not try a drug is one of the most important decisions that you can make. Over time, pop culture seems to glorify drugs more and more. Drugs have been promoted as solutions to mental health struggles like depression and anxiety. Trying drugs has been normalized as something that is just part of going through life. In reality, it is something that will take your life from you. With fentanyl's increasing prevalence in nearly all drugs today, promoting drug use is one of the most dangerous messages an influential person can communicate, especially to young people. The glamorous lifestyle associated with drug use is a facade. Many famous people suffer brutal addictions behind the scenes, and fentanyl is exposing that truth. More and more great artists, athletes, and talents are falling to fentanyl. With them are many others who fell for the lie that using illicit drugs can solve any pain or problem in your life. It is a lie you must be smart enough to see through. Fentanyl is a death trap that very few escape once they enter into it. Do not be deceived. Fentanyl has turned drug dealers into death dealers, and today's easy access to drugs means that a dealer could be anybody. Most illicit drug sales today happen online and over social media. Many of the drug death stories I've encountered are of teens and young adults who bought a pill or a bit of cocaine and had it delivered to their family's house. A lot of times it was from somebody that they knew. Let's make this clear. It does not matter how well you think you know someone. It does not matter if they tell you the drug that they have is really what they say it is. You both do not know if fentanyl is in that drug until it is too late. Just because you've seen a friend try a drug, or even if you've tried something before, does not mean it's going to be safe. These drugs are not coming from a pharmacy or a lab with quality control. These drugs are being blended together by random people who do not care about you and bagged up for a quick profit. What seems like a safe dose could contain enough fentanyl to kill multiple people simply because of how carelessly these drugs are made. Again, you won't know until it's too late. Fentanyl is now the leading cause of death for young people in the United States. Some are looking for relief, some for a good time, many are just curious and make a stupid mistake. Had they known fentanyl was in the drugs they took, they never would have done it. But they can't take that choice back now. You, though, have a choice to make for your life. You may struggle sometimes and feel like you need help. You may get curious or tempted to try a drug. Remember that feelings are temporary, but some decisions can last forever. You always have the opportunity to choose something greater, something that will give you life and not death. I encourage you today to realize how precious your life is, and that one choice is all it takes to throw it away. Please do not do it. Remember that you have a purpose. You have gifts and passions that are unique to you. You were made to have a future. You can live an amazing life without ever touching a drug. Just keep going after the things you know are right, things that are good for you. You'll be an example for your friends, and you can encourage them too. If you're a young person and learned something from this video today, I want you to share it with your friends because this information is saving lives right now. You could be the friend that saves someone's life by keeping them from making a big mistake. Please share it. If you're a parent or guardian and you want to learn more about how you can educate and protect your children from fentanyl poisoning, then I need you to head over to naturalhigh.org/fentanyl right now and sign up with your email to receive the free fentanyl toolkit. Natural High will keep you updated with information and resources you can share with your children. My name is Dominic Tierno. My natural highs are faith and filmmaking. Thank you for watching.
And again, I really like that video because it does drive home the point that we're trying to make with our students, which is take this information, take this message, and please, please share it with your peers. A lot of times, students will notice things in the video about the people that are wearing gloves, and that question comes up a lot. And that's because nobody wants to put their hands on this stuff. Because it could seep into through your skin. So the video was really good at driving home a lot of the points that we really want to emphasize with our students. So what are some of the signs of an overdose? If somebody is overdosing or you suspect somebody's overdosing, they might be exhibiting these signs: falling asleep or losing consciousness, choking or gurgling sounds, small constricted pinpoint pupils, slow, weak, or no breathing, a limp body, discolored skin, especially in the lips and nails, and cold or clammy skin. If you or a student suspects that someone is overdosing, these are the steps that they should take. They should call 911 immediately. They should administer naloxone if it's available. They should try to keep the person awake and breathing. Lay the person on their side to prevent choking, and stay with the person until emergency assistance arrives. Again, we get questions about that last bullet because students want to know, will they get in trouble? Even adults want to know, will they get in trouble if they stay they call 911 and they stay there with the person, you would not get in trouble with the police. There is, or the law, there is a Good Samaritan law, I believe it's called. And there's a Good Samaritan law in probably most of our states. Maryland definitely does have one. So again, we want to drive home that if you stay with the person, you will not be in trouble legally. And here's another very quick video that I will share with you.
I'm an ex-drug dealer, and I'll be your sub today. I did 18 and a half years in prison for selling drugs. So everyone put on your gloves. Please place it under the microscope. Can you see anything different as a pill? No.
No.
No? 2 milligrams of fentanyl can be lethal. Now, a lethal dose is in here. Who gets it, I won't know.
Fentanyl is being mixed into everything now. I used to be a drug dealer. There's only one thing that will save somebody's life. That is naloxone nasal spray.
I used to deal drugs when I was in school. Fentanyl, it's cheap, it's potent, and it's profitable.
Why would drug dealers put a lethal dose of fentanyl in drugs if they know it's so harmful?
Really just all about the money.
I'll just tell them be careful and only take what's prescribed to you. Last thing I want to see is my friend on the t-shirt, you know what I mean?
I just didn't realize that one pill could change your whole life.
More kids should know. More kids should know.
So our schools do have some resources that students, if they feel like they need help, or if they know someone that might need help, there are people in the school that students can reach out to. Of course, one of those would be the school psychologist. Another would be your professional school counselor. Another would be the school mental health clinician. Some people don't even know that we have school mental health clinicians in most of our schools, actually. But most of our schools do have a school mental health clinician, and they are there as a resource. And of course, your professional school nurse is also there as a resource. I always encourage people, parents or students, especially students, to talk to an adult that you trust. There is a SAMHSA National Crisis Hotline, which is listed. There is a crisis text line, which is text home to 741-741. And there is also the National Suicide Prevention Lifeline, which is dial 988. And I've been in schools recently, and I have seen posters and flyers for the SAMHSA National Crisis Hotline and the National Suicide Prevention Lifeline. So a lot of times parents are going to ask, well, what can we do to help prevent our students from experimenting with drugs? Prevention starts with parents. And again, I'm not here to lecture anybody, but some suggestions would be teach your child different ways to say no. We had a conversation earlier today And we have to remember that students go to parties, they go out, they go places, they go out with friends, they go to school. The adult is not always there to tell them what to say. So students need to be taught by the parent how to say the word no. Provide guidance and clear rules about not using drugs. Do not use tobacco or vape products or other drugs yourself, and certainly not in front of students. Correct any wrong beliefs that your child may have about drugs. In 2022, there's a lot of confusing messaging out there for young people. It's legal here, it's not legal there. It's benign, it's pretty harmless, or it is very harmless. It's going to be legal in Maryland, I believe, in July. Students believe that that makes it okay for marijuana, and it doesn't. It may be legal in July for somebody that's an adult, but it is not going to be legal for an adolescent. And students need to understand that. Encourage positive friendships and interests. Help your child to make smart choices. Keep in mind that music and music videos and video games glamorize tobacco, vape products, alcohol, and drugs. Know what your kids are watching, playing, and listening to. I also wanted to share with you some websites that parents might find helpful. And once I'm given the okay, I'm going to try and get this information out there on the PGCPS website. But one is, of course, and I'm going to click on this and share it with you. There are several, but one really good one is the DEA Operation Prevention, and it's for parents. As you can see here, it's also for school teachers. It can also be used in the workplace. It has culture-based prevention resources, and many of the lessons are in Spanish. So I'm going to kind of end exactly where we began this evening, and just reiterate that most of you will never use illegal drugs, but you have peers and friends that might be thinking about it. Again, share what you heard today with others, other parents, other students, family members. Please share what you learned today with other people. And remember that Prince George's County Public Schools is committed to educating its students. We do not want to see our students die. We want our students to graduate. We want our students to go to college. We want our schools to graduate from high school career ready if that's their choice. But we do not want to see our students dying, especially of something as horrible as this trend that's going through the country, actually. So at this time, I'm going to give everybody a couple of minutes to please take out your phone and scan the QR code. We really would like to have your feedback, and then I'm going to move on to the next segment of the presentation. But if I could just give you a minute or two to scan the QR code and provide us with your feedback. Thank you. All right, if everybody's ready, I'm going to move on to the next section of tonight's presentation. And that will be some questions and hopefully answers that myself or our panelists can respond to. So panelists, I've got your names up there on the slide, and I'm just going to let you, in the order that you're listed, if you could just go through and introduce yourselves. And if you want to make a comment about the presentation, that's fine. And then we're just going to go to the questions and answers that are in the chat. And it looks like there are a lot of them. So again, you already know who I am, Richard Moody, and I will let Mr. Lewis go ahead.
Daniel Lewis from the Department of Safety and Security Services, Field Operations Supervisor.
Good afternoon. I'm Dr. Tracy Jones. I'm the supervisor for the Office of School Health for Prince George's County Public Schools. We provide nurses for all of the schools.
Dr. Emanuel.
Good evening. My name is Bobach Manuel. I'm a physician and internist and an addiction medicine specialist. I am the medical director for the methadone clinic at Prince George's County.
Thank you.
Good evening. I'm Major Chad Schmick. I'm the commander of the Narcotic Enforcement Division for the Prince George's County Police Department.
Good evening, everyone. Wait, Ms. Ramser, are you here? Sorry. Go ahead, Ms. Pat.
All right. Go ahead, Sade, so my dog can start barking.
Okay, good evening, everyone. Ms. Campbell here, currently a community developer, specifically the program recruiter for the Prince George's County Health Department Adults and Clubhouse.
Good evening, I'm Pat Ramser, the Alcohol and Drug Abuse Prevention Coordinator for Prince George's County Health Department.
And Mr. Guys, are you available to say who you are, sir? All right, he may not be. So at this point, I guess we can go to the chat and see if there are any questions that we might be able to address or hopefully answer.
Can you guys hear me now?
We can, thank you.
Oh, okay, I'm sorry, it wouldn't let me get in. My name is Tyrone Geis. I'm a supervisory special agent with the DEA.
Thank you, Mr. God.
So I can see a few questions in the chat that have come in. And we thank you for everyone who has utilized the chat in the way that it should be tonight as we discuss this very serious issue. The first question is, please provide information as to where this recording can be accessed after the presentation. And I guess I'll address that. We have been intentional about uploading all of our Wellness Wednesday and or parent sessions to our PGCPS YouTube channel. And so this presentation and a video of this will be also uploaded to that website. Additionally, we'll provide an opportunity for this presentation, the information to be uploaded to our student services webpage as well. But you may be able to watch the recording again on our PGCPS YouTube web channel.
Thanks, Dr. Faison.
Another question came in that asks, can someone who is experiencing an overdose, if they sweat through their pores, affect someone who touches them who is assisting them?
And the answer to that question is yes. Hence the gloves, while they were illegally manufacturing that pretty much garbage fentanyl. But I will let anybody else that's on the panel speak to that as well. Maybe even a little more detail.
Mr. Moody, are we asking if somebody is providing assistance for somebody who's possibly experiencing an overdose, will they be affected by the drug? Is that what the question is asking?
I believe that's what they were asking, yes.
Okay. To that, I would say in the instances that we have experienced, that we have been a part of thus far, I would say that's not a fear that I would tell a student. You know, the move, as was plainly expressed in the videos and in your presentation, Mr. Moody, was very good. And what I would say is, if you see somebody experience a possible overdose, help them. You know, don't be afraid to touch them. What I might ask people to be mindful of is if you see any items that they may have been utilizing. Let's say if they were if you see what appears to be the drug on the floor, I would say leave it, don't touch it. Or if you see a vape or any other kind of instrument by which someone might have been utilizing, any paraphernalia, if you will, to take in the drug, I would say maybe leave that. But as far as helping the patient, I would say by all means, please help the patient. Do take all the steps that were expressed in the presentation to help the patient. You don't have to fear that any kind of perspiration or anything coming from the patient is going to turn to the person helping and negatively impact them.
Thank you.
Question asks, are the videos shown here also shown to students? Are there other tools used by the school and available to the parents as well?
I've been doing the presentations recently, and yes, these videos are a part of the presentation for the students and the staff at the schools. And what was the other part of the question?
Are they being made available to parents?
I would like to see eventually a lot of the information that's in this presentation made available to parents via the website. That would be what I would like to see happen, yes.
The question asks, is marijuana also being laced with fentanyl?
We see it on a regular basis. We do see it on a regular basis, yes. More and more of the marijuana that is sold in the streets is laced with fentanyl, yes.
That's nationwide too, it's not just here.
Can you speak to the mechanisms that students can use to anonymously report other students who may deal drugs or potentially in crisis and are using drugs?
Yes, I can answer that. Yes, any student can go to their administrator and or security anonymously and let them know what they're seeing or who they're saying using or selling any type of illicit CDS in the schools without fear. Our security team in the school does a great job of not letting anyone know where they're getting this information from. And then from that, depending on the situation, we pass it on to the local authorities. So they can, like I said, again, they can go to their administrator anonymous and make an anonymous a concern and or a security team member if they're in a school that has security in it.
Very similar to an earlier question, someone asked, does tobacco have fentanyl?
Not that we have seen. Tobacco is produced by tobacco companies that is heavily regulated, so no, we have not seen that.
Mr. Manuel or Major Schmick, That question leads me to another inquiry. Has anybody found or seen vape cartridges that contain fentanyl?
Great question, Mr. Moody. And oddly enough, this week, my team has intercepted some vape cartridges, a parcel where the preliminary tests showed a positive reaction for fentanyl. That's to say, kind of like what is highlighted in the presentation, is these drug trafficking organizations are finding all sorts of ways to profit. And the big ticket item that we want to mention is if you're not buying, purchasing anything from a medical professional or getting it from a guardian or parent or what have you, the assumption should be that it is poison and that it could kill you. We have to remind ourselves that with the children in the schools, they don't have the capacity, the ability to go to a corner market, a tobacco store, or whatever to purchase cigarettes or to purchase vapes or whatever. So, so they have to get those by other means. Well, if there's a black market that exists for these means, then the assumption should be that those cartridges are not going through the same regulations, if you will, for those tobacco shops. Again, it has everything to do with profits. And like the doctor has mentioned, if it's not regulated, the assumption should be not that it is what you believe it is, it should be that it's poison. And if we lean in that direction, the hope would be is that we can avoid these instances in the future.
Thank you, Major, for really re-emphasizing that.
A question that has come up in the chat is asking, is there a way to know if marijuana is laced? In other words, will it change the look, the smell, the texture, or will anything change about it when it is laced with fentanyl?
Unfortunately, it will not. It is tasteless, colorless, odorless. It will not. So a lot of perks is being sold as fentanyl. A lot of marijuana that is laced is being sold without people knowing it. And unfortunately, by the time they find out, many times it's too late.
And if I could add a point that the doctor mentions is also that the dealers don't know if any of these items are laced or contain fentanyl. So that's to say, again, it's not that these items are going through any kind of regulation. This is all through the black market. So there's no means of knowing. It's, you know, you can't say, well, I've always used this dealer and they've always provided me marijuana and it's been just fine. We can't make that assumption because these organizations are thinking all about profits. And when you're talking about a synthetic drug, a man-made drug that is that much more powerful, these organizations are usurping the system and thinking, well, what can I do to add some more kick to what I'm selling and make more money, with zero regard for the clients. And again, you know, if it's not, you know, if none of the lower level persons are aware, right, then we're talking about a scenario where nobody can say wholeheartedly, oh no, this is safe, it's not laced. Again, the lean should be that the belief that if it's not, you know, that if it's got received off the black market, it should be assumed that it's poison.
To answer your question, Mrs. Powell, I saw it pop up. Yes, this is being recorded.
I'm assuming an employee, yes, is asking, can an employee be held liable if they help a child who is having or who is overdosing from fentanyl? Can an
I-
employee be held liable?
I'm not sure I understand the question. Employee being held liable because a child has overdosed?
If they are assisting a student who is overdosing?
Oh, I see. There are Good Samaritan laws that protects people that are helping individuals that are going through overdose. So no, if you are acting good faith, trying to help somebody, you will not be held liable.
Another question asks, are there specific communities or locations in our county where we're seeing fentanyl being used the most? And is there any idea as to how it's being acquired?
I would like to jump in here. I'm in the business of helping people who are suffering from opiate addiction. We used to take care of people with heroin addiction. There is no heroin street anymore. For the past couple of years, we have not seen any heroin. Anybody that sells the heroin, anybody that purchases the heroin, it's really not heroin, it's fentanyl. So whenever you see the term dope or heroin, it's really fentanyl. And it's all over the country, not just one area, it's everywhere, unfortunately.
And as far as in Prince George's County, there's no specific group, age group, or no specific culture, ethnicity. Across the board, we're seeing the challenges with fentanyl across the board. No specific areas in the county, nothing like that. It's all over the place.
Important question is asking, where can we obtain Narcan?
The health department provides that free of charge. You would go through a training, which is about an hour long, and then you get a kit for free, which includes not only the Narcan, but also gloves, a mouth barrier that if you have to give the mouth-to-mouth resuscitation and other literature. So the PG County Health Department provides that free of charge.
Dr. Emanuel, can it also be purchased in a drugstore like a Walgreens?
Absolutely, it can. It can be purchased in a drugstore, and yes.
And there is no prescription required, is that correct?
That is correct as well. Yes, no prescription required, but there is a charge for that. And if you want to avoid that charge, the health department provides that free of charge.
Thank you.
Thank you.
So to recap on an earlier part of Mr. Moody's presentation, someone is asking, can you reiterate the immediate sign that someone has been poisoned with fentanyl?
Yes. So the signs of an overdose are, again, falling asleep or losing consciousness, hearing choking or gurgling sounds, constricted pinpoint pupils, slow, weak, or no breathing at all, a limp body, discolored skin, especially or particularly the lips and the nails, and cold or clammy skin.
Thank you, Mr. Moody. Another participant wants to know the correlation between Molly and fentanyl. Is fentanyl known to be in the pill Molly?
I'm going to let someone else speak more definitively, but I think that they're seeing fentanyl in everything practically. If they are seeing it in marijuana, I think it would be very likely that crystal meth, Molly, that any of those drugs could potentially have fentanyl in it. But I can let somebody else address that question as well.
I can speak on behalf of that. Yes, Molly is kind of like a street term for it's whatever in the pill, because we've found all sorts of drugs in the Molly capsules. So it's kind of like a buffet, if you will, of all kinds of things. But we are seeing fentanyl inside the Molly. So again, you know, rather than highlight on a specific type of drug, I really think that the point to strike home is that it is about it didn't come from a medical professional, assume it's poison. I think that's the conversation that really needs to hit home and start with the parents, with the kids and extended family and loved ones and community groups, what have you. Because of the dangers of this drug and not knowing if it's in whatever somebody is taking in their bodies, the best way to avoid it is to avoid the drugs completely. And that's, you know, that's just to say, you know, to be specific again about, well, if it's poison, then it could kill you. If you want to make that decision, just know that could happen. Not so much yes, to scare people, but to highlight how rampant this is, how the fentanyl, the doctor has mentioned it, Richard, you mentioned in the presentation, how fentanyl's taken over. And because it's taken over and we're seeing it everywhere, that's the message we want to hit home.
Scientifically, Molly is the same thing as ecstasy. So it's really a different class of drug. But as the major alluded to, whatever they're selling as Molly, it's a hodgepodge of different medication, different drugs that is meant to produce euphoria, but could be deadly. But scientifically speaking, Molly is is ecstasy, which is actually a stimulant, as opposed to opiates, which is a depressant.
Thank you. Someone is asking, are there any long-term side effects for a student or youth who survives a fentanyl overdose? And if there are, what might they be?
Absolutely. So overdose happens when you stop breathing. And when you stop breathing, there is inadequate blood supply, inadequate oxygenation. The first part of the brain that gets damaged is the brain. And all depending on how long you go without oxygen, the damages could be mild to severe. Severe damages would mean essentially you lose memory, you lose function of your limbs, you lose ability to speak. It all depends how long you went without oxygen. But definitely there could be long-lasting effects of overdose.
Are you responding?
No, I am not, Dr. Pazon, talking to my screen in the background. Apologies.
No, thank you. I just wanted to make sure. Another question is asking, is the school allowed to conduct random drug tests if there is a suspicion that someone uses fentanyl? I think Mr. Lewis.
So the question is the school allowed to conduct random drug tests if there is someone is suspected of using fentanyl? No, the school is not permitted to do a random drug test on any students in reference to any type of CDS. Now, what the school can do is if they suspect that a student is on a CDS or any other type of illicit drug, they can call the parents and then have the parents, if the parents would like to have their child drug tested, they may take them to a facility where they can be drug tested or give them at-home drug test from one of the over-counter drug tests.
Thanks so much, Mr. Lewis. We have 15 more minutes to answer the questions that you have. So if you have questions and no one has asked the question that you have, please don't be shy. We have a number of experts that have joined us tonight to talk to you and to address any question that you have. And so we're working diligently to go through the chat and make sure that we're referencing every question that's been asked, whether in English and or Spanish, to ensure that our time with you is well spent. One additional question, I assume is from a student. It says, when you talk to your friend about stopping smoking, why can't they stop? What is causing an individual to not be able to stop using drugs?
I'll take that. So let's talk about definition. What does addiction mean? Addiction is a behavior that repeats despite negative consequences. So think of somebody who is an alcoholic. They are having arguments with their family, but they continue to drink. They have a DUI, but they continue to drink. They have different negative consequences of this behavior, but they continue to do this behavior. That is the classic example. That's a classic definition of addiction. Addiction is a behavior that happens despite negative consequences. Next question is, people that are addicted, are they bad people? Are they people that have no ethical, moral values? Why is it that they keep doing that? The answer is a brain disease. People that have this disease, the part of the brain that's supposed to send a signal, hey, don't do it. These are the things that can happen to you. That part of the brain is silent. When they see the drugs, when they see the alcohol, that's all they want. They are not thinking, hey, I just lost so many thousands of dollars defending my DUI. I better not drink. Or I just spent so many months in jail because of drug use. I better not do that. When they see drugs, they want it. That's addiction. That's the brain disease. And that's why these people keep going to it time and time and time again. It's a chronic condition. It's not a disease that you can cure. It's a disease you can treat, but not cure. Why does it keep happening? Why do these people keep relapsing? It's not because they're horrible people. No, it's because of this brain disease. The brain is not functioning. Part of the brain has been hijacked that is supposed to send a signal, hey, don't do it. Hey, there are going to be severe consequences. That's why these people relapse time and time again.
And Dr. Faison, I'm not sure if that student was specifically referring to when they used the term smoking. I don't know if they were also referring to cigarettes or nicotine, but just so that student knows that they should also be aware that nicotine is also addictive.
Thank you for that. Another question in the chat says, what are the charges that will be given to a person who is selling drugs in school?
I can answer that.
Yeah, go ahead.
Oh, go ahead.
No, go ahead. Go ahead, Daniel. Go ahead.
For the in-school selling of drugs, there's multiple different charges that we could use if we got to that point. But primarily the first couple could be a possession of CDS on school property, and or the other one that has been used in the past is possession with intent to distribute CDS on school property. Now, if it becomes a little bit major than what we tend to deal with, we then generally call in the local authorities, Prince George's County Police, or another agency to deal with that that student or those students, and then they take the investigation on from there. Is there anything else major?
Nope, that's you highlighted everything perfectly. Those are the general charges that come with that kind of behavior on school grounds.
Wants to know, can this information be shared with students younger than middle school age?
I can try and answer that. I can take that question. We would have to create probably another presentation because the video that everybody seemed to like was with the first video with the guy that kind of looks like Eminem. That they specifically put a caveat that you should not show that video to anybody that is 11 or under. So yes, a presentation could be created. I don't know that it would be this one though.
To review questions. Another question is about the resources or pamphlets or prevention programs that are in schools. Are there pamphlets that are available in schools or resources? If not, when will they be?
I can take that. I was at a school today, and in the main office, I did see what we had sent out. I think it was maybe over the summer or before the summer. It was right up on the desk in the main office. So my office, Student Engagement and School Support, we do send literature out to schools, and we're going to continue to do that. And we will probably be focused a little more on opioids as well now.
One participant wants to know, can students actually carry Narcan?
I really don't see a reason why they cannot, why they shouldn't. If they're going to, especially if they think that they're going to be coming in contact with somebody that is about to overdose. Yes, I have no issues. I don't see any problems with that.
Dr. Faison, Sylvia Quinton has her hand up.
Place all questions in the chat. We can ask those questions. Thank you. I do see a question that says, will the health department allow students to go through the hour-long training so they have an understanding of how to use Narcan?
Good question.
I honestly do not know the answer legally, whether we are allowed to do that or not. That's something I will have to get back with you on that. I apologize. I don't know the answer to that. More than likely, the answer will be yes, but I don't want you to quote me on it.
So along the same lines, will the school nurse have Narcan in schools?
All of the school nurses have been trained to administer Narcan, and all of the middle and high schools nurses have been provided Narcan. We're waiting for the Narcan for the elementary school nurses to come in.
I would also like to add here, it's wonderful to have Narcan and wonderful to educate the public about Narcan. But I just wanted to mention Narcan is just the tip of the iceberg. Somebody that has overdose, more than likely, it's more than a one-time use. More than likely, these people have an addiction and they need treatment. And I cannot emphasize enough, treatment is what gets them better. Treatment is the gold standard, not just giving them one-time Narcan and saying you're good to go, move on, let's go. So anybody that has overdose, that comes close to overdosing, please remember they need treatment.
Now, along those lines, there is a question now that is asking, if a child is addicted to fentanyl or another drug, what is the best practice for detoxing and helping the child or student address the addiction? What's the best treatment for a child who is addicted to drugs?
I'll take that. So there are two different ways of treating addiction. One is the abstinence-based programs, and then we have the medication-assisted programs. For a child that is addicted, we like to start with an abstinence-based program, a residential program, a detox program, as opposed to a maintenance program. However, research has shown that the maintenance programs are a lot more effective, a lot more powerful as far as keeping individuals abstinent. I'm not sure if that answers the question or not, but yes, a child that has an opiate use disorder, they really should be in a residential program or a rehab program, trying to detox and trying to get their life together, as opposed to going the other route of medication-assisted treatment.
Along those same lines, are there inpatient facilities that are for students who are willing to be a patient and to receive treatment? And are they local?
So my main focus is adult addictions. I really do not deal with pediatrics. However, if they want, anybody that wants treatment, call the health department. We will help you get to the right place. And I cannot emphasize enough, if we cannot provide it ourselves, we will find places for you.
And Dr. Faison, if I can just add on to what Dr. Emanuel said, we have and we will continue to provide parents with places that they can take their child if they need some sort of inpatient or outpatient treatment. Unfortunately, there are not a lot that we have locally, but we do have some, and we'd be happy to provide that information to anyone, really.
Is there a phone number that an individual should use if when they're calling the health department and they're seeking help with substance addiction?
I would just say call the main number.
That in the chat, and I'll make sure everyone has access to that. Another, okay.
Yeah, I'll put it in the chat.
Another parent is asking, what are some signs that parents should look for to determine if their student is addicted?
Believe me, the parent will know. There's a change in the person's behavior. They are no longer interested in things that they have been doing. They are no longer interested in activities that they enjoyed doing. They limit their extracurricular activities. Their attendance in school drops. Their participation in school drops. Their performance suffers, and they basically give up on a lot of friends and relatives that they used to spend time with. And they also realize that their child is being a hermit, not really wanting to interact with people.
There's one question that says, how can we elevate this session to direct action and prevention activities? What plans might we have moving forward to assist students in our schools around creating actions and also towards prevention?
Dr. Faison, I can try to, I can answer, and then if anybody else wants to jump in with their thoughts. As I indicated earlier at the very beginning, we have started to do grade level assemblies in school directly with students. We have also convened for lack of a better word, a task force. Many of the panelists are a part of that task force. So I think as we decide to, when we reconvene, which hopefully will be soon, I think at that point, we'll be able to establish next steps. The reason why the assemblies took place was because immediacy was really important. And what needed to take place was an intervention immediately, so that students were getting this information. The next steps that will follow, I guess, will probably need to be determined very soon by the members of that task force.
One thing I would like to mention is I cannot emphasize enough that parents should discuss this with their kids. I cannot emphasize how important that is. If you do not discuss that with your kids, the kids will get this information from sources that you don't want them to get.
Yes.
And it will get them to the places that you don't want them to get to.
Yes.
I cannot emphasize this is something that needs to be discussed with your kids on a regular basis. 107,000 people died last year, and the numbers are only going up.
Just like the doctor mentioned, the grassroots part of this campaign, if you will, is just get everybody talking about it. That's where the effectiveness will be. Get everyone talking about it, and with the same message, right? That's where we have parents talking to kids, parents and kids talking to other people in the community groups talking to other community groups, really empowering the parents and the kids at each individual school, all talking about it. That's where this effectiveness is going to be, taking this message that Richard, with the presentation that Richard provided, and just passing it on. That's where we're going to be effective. Where this meeting is going to take legs, if you will, and push forward.
Thank you so much. We are at the close of our session tonight, and this time really has gone by so quickly. I thank you, parents and students who have come out tonight to be a part of the discussion. It is important to us to keep our students safe, and parents, by you receiving this information as well, you're able to pass it on to your friends and relatives and to your colleagues so that our entire community are aware. We want to thank Mr. Moody, Mr. Daniel Lewis, Dr. Tracy Jones for joining the session, Babak from the Health Department, as well as Sade from the Health Department. We want to thank Patricia Ramsier, also from the Health Department, Mr. Chad from the Police Department, as well as Tyrone from the DEA. And so our time with you tonight has been well spent. And I think Sylvia stated it best. This cannot be a one and done. We have no intention of stopping. We really are just beginning this work, rolling out information to students so that you are aware. Mr. Moody has already conducted sessions with every student in High Point High School, grade level by grade level assembly, every student in Northwestern High School, grade level by grade level assembly. And he is also planning to do the same with a middle school right now. And our task force that's been referenced earlier is working on a plan to roll it out to every single school so that our students are aware. Even our SROs, or our security resource officers, are beginning to go back into the classroom and have their presentations. So there are lots of arms and legs that are coming together and putting our expertise and our resources together to make a difference and to raise that awareness, as Chad mentioned earlier, and to raise the awareness, to have the conversation, and to remove the unknown, the ambiguity. And we know that sometimes students may take a pain pill that they're getting from someone that they trust as a friend. And if it is not a prescription drug that is prescribed to you by your own physician, it should not be taken. I lastly want to reiterate the reason some of our students are self-medicating and experimenting and maybe taking any kind of substance. may go back to the fact that they need support and they may have mental health challenges. It may be anxiety or depression, or they need a shoulder to cry on or someone to talk to. And if that is the case, we have mental health clinicians in our schools. We have school counselors in our schools. We have social workers in our schools. We now will have Hazel Health in our secondary schools, where our students will be able to receive counseling through teletherapy. And so there are a number of supportive resources that are out there for our students. We don't want a temporary decision to be a permanent impact to the lives of our students and to you as our parents and our community at large. So I thank you for joining tonight. We have much work to do. If Mr. Moody, if you'll put the slide back up, that requests parents' feedback. We want to know what you think so that we can improve upon the next session that we have. And so we thank you for joining. If you'll take a moment and use your phones to screenshot the QR code and answer the feedback form, we would really solicit your feedback. Additionally, I am adding in the chat the actual link to that QR code. So feel free to utilize the link or the graphic that's on the slide for us to receive your feedback. And so it is with that that I say thank you very much to all of the students who came on tonight, who spent time learning about this and who will share this information with your peers and your colleagues. Whatever you do will be critical and important. And so I thank you to the parents who took time to sit down over dinner or sit down after a long day's work and listen to our presentation and ask the questions that you have. We value your time. We value your participation, and we thank you. Until later, have a wonderful night. What I will say is next week, we'll be back for Wellness Wednesday session number 3, where we talk about navigating the winter and or holiday blues. It will talk about depression. It will also provide strategies to parents who may have lost a loved one during COVID. And we know that the holidays and the winter times brings back memories of those loved ones lost. And we want to continue to support not only the mental health of our students, but of our parents as well. So join us next week for Wellness Wednesday, navigating the holiday and winter blues. So thank you so much, and we'll see you another time.
Dr. Faison, can they see the QR code?